Welcome to The Explainer. Look, if you're tuning in right now, chances are you're stepping into a recovery process. And I want to start by just validating exactly what you're going through. If you've recently had a sudden jaw movement, maybe you felt a noticeable pop, and now you're dealing with some honestly really scary physical symptoms like sudden facial weakness, intense jaw tension, or just strange sensations, you are not alone. And more importantly, you're in the right place. Today, we're laying out a clear step-by-step guide designed specifically for new patients who need to understand exactly what is happening inside their bodies and exactly how to fix it.
First things first, we've got to shift your mindset. You're probably asking yourself right now, is this just a really stubborn muscle knot, or is it a nerve issue? I need you to know that what we are exploring today is absolutely a nerve recovery process, not just a simple muscle ache. Your body is dealing with irritated nerve pathways, changes in circulation, and nervous system regulation. Treating this like you just slept on your neck wrong, yeah, that's just not going to cut it. We have to approach this with the specific goal of healing your nerves. All right, here's our roadmap for today. We're going to cover understanding your nerve symptoms, the gentle healing philosophy, step 1 with targeted massage, step 2 covering acupuncture, your weekly recovery protocol, and finally, setting expectations for your healing.
Okay, let's jump straight into section 1, understanding your nerve symptoms. So inside your face and neck, you've got these incredible nerve pathways acting literally like an electrical superhighway, controlling your movement, sensation, and even how you process sound. But here is what happens when things go wrong. Nerve irritation happens when those delicate pathways are stressed, very often from a sudden jaw shift or extreme tension. It's actually wild how sensitive these nerves are. Even a single millimeter of inflammation can cause your body to panic. It goes into this heavy protective mode, reacting by tightening up your muscles and entirely changing how signals are sent across that superhighway. And because that signaling is totally out of whack, you might start experiencing a few very specific symptoms. We're talking intense tightness in the jaw, often labeled as TMJ issues. You might see scary changes in your facial movement, or you might even start hearing a ringing in your ears. Now, these might seem like totally unrelated issues, right? From a locked jaw to ringing ears, but they are actually all connected through those exact same irritated nerve pathways. It's really just one interconnected system reacting to stress. Which brings us to section 2. The gentle healing philosophy. Now, this is where we completely flip the script on recovery. For most of us, human instinct says, hey, a muscle hurts, rub it as hard as possible to work out the knot. But remember, this isn't just a muscle issue. Aggressive deep tissue treatment actually causes way more stress, is super painful, and actively slows down your progress. Think about it. Your nerves are already screaming, and pressing harder just makes them scream louder. Instead, we have to shift entirely to gentle, light touch. True healing comes from reducing pressure, improving circulation, and supporting your body's natural ability to heal without forcing it. Let's put this into practice with step 1, targeted massage. Let's talk about how to correctly use professional massage therapy to help your body safely let go. Honestly, if you take absolutely nothing else away from this section, memorize this exact script to advocate for yourself. When you walk into a clinic, look your therapist in the eye and say, I'm recovering from a jaw and facial nerve issue. I need gentle, nerve-focused work, not deep tissue. Saying this guarantees a safe, effective session that won't trigger further nerve irritation. You want to leave that room feeling relaxed, maybe with a slight warmth in your face, and absolutely zero soreness. None. You also got to play director a bit and tell your therapist exactly where to focus. Direct them behind the ear, which is actually where the facial nerve exits. They should gently address the jaw hinge, where the original issue likely started. The upper neck and base of the skull are absolutely crucial for supporting nerve signaling. The side of the neck, incredibly important for lymphatic drainage. And if they touch your face, it must be light touch only. Instruct them to use super gentle circular motions and delicate muscle release. Moving right along to step 2, acupuncture support. Acupuncture is kind of the perfect tag team partner for your gentle massage routine. It works a bit differently than massage, but it is deeply, deeply effective for nerve recovery. We use acupuncture to reduce that nerve irritation, drastically boost blood flow to the face and jaw, support actual nerve healing, and most importantly, calm your body's overall stress response. By targeting jaw points, ear points, and systemic calming points once or twice a week, acupuncture creates the absolute perfect internal environment for your recovery. But listen, timing is everything here. It is highly recommended that you book your massage and acupuncture on different days. If you're in a pinch and absolutely have to do them on the same day, always do acupuncture first, followed by only a gentle massage. The crucial point is avoiding back-to-back intense treatments. We do not want to overload your recovering nervous system. All right, let's tie this all together in Section 5, your weekly recovery protocol. In our source material, this is famously referred to as the Gary Protocol, named after the author's own specific healing journey. Honestly, go ahead and pause to screenshot this. It's a weekly cadence that perfectly balances professional therapy with the essential rest your nerves crave. Notice how spaced out the professional treatments are. Gentle massage Monday, acupuncture Wednesday, maybe some light bodywork Friday. But look at the rest of the week. Tuesday, Thursday, Saturday, and Sunday are dedicated entirely to rest and your home routine. You are giving your nervous system the breathing room it needs to actually integrate the healing. So what exactly are you doing at home between clinic visits? You're taking control of your own healing by dedicating just 20 short minutes a day to these 4 incredibly gentle steps. Apply heat for 10 to 15 minutes to boost circulation. Do a very gentle self-massage for 3 to 5 minutes. Spend just 1 to 2 minutes on facial exercises and practice humming daily. Yeah, humming. It physically vibrates and soothes those exact nerve pathways we talked about earlier. Just remember, keep the pressure super light. Alongside the physical work, we've got nutritional support to tackle this from the inside out. Slowly integrate this comprehensive supplement schedule. It's broken down by time of day to literally fuel your cellular recovery around the clock. Notice the heavy focus on nerve-supporting heavy hitters like B12, omega-3s, and magnesium to calm the system, along with olive oil. But hey, a quick word of warning. Don't rush out and take everything at once. Add these in slowly and focus on consistency. Finally, let's talk about Section 6, setting expectations for healing. For all you new patients just starting out, we really need to set some realistic expectations so you don't get frustrated. Healing a nerve is not like flipping a light switch. It's a dial that slowly turns up. You won't wake up tomorrow completely fixed. Instead, look for the early signs. First, you'll notice reduced tightness. Then you might feel a slight warmth or mild tingling as that circulation comes back online. You'll start to have a calmer feeling overall. And eventually, you'll see a gradual return of facial movement and way more stable symptoms day to day. Celebrate those small wins because they mean it's working. I really want to anchor this whole explainer with this one core truth, straight from our source material. The body heals best when it feels safe and relaxed, not when it is forced. Your goal as a patient is not to bully your body into changing. Your goal is simply to create the absolute best, gentlest conditions so your body can do exactly what it already knows how to do. Which brings me to my final question for you. Are you ready to stop forcing change and start genuinely supporting your recovery? Really ask yourself that as you take your next steps. Your system absolutely can reset. It can recover and it can move forward. Follow your personalized plan, stick to the gentle protocols we laid out today, and above all else, stay consistent. You've got this.